Alright, this is a presentation about diabetes in school-aged children. So this is just the basics. What is diabetes? Diabetes in children is considered type 1 diabetes. It's a condition in which the child's body no longer produces insulin, which is an important hormone. Humans need insulin to survive, so you need to replace the missing insulin if your body can't produce it. Diagnosis can be really overwhelming, but the child and their parents together must learn how to give injections, count carbohydrates, and monitor blood sugar. Some signs and symptoms of this are excessive thirst, fatigue, hunger, or sweating, nausea and vomiting, bedwetting, or excessive urination. Other symptoms that might be common are blurred vision, fast heart rate, headache, sleepiness, or weight loss. Other things that are like considered basics is the diagnostic tests involved. So these are the tests that could be run on a child to see if they have type 1 diabetes. So the most common is random blood sugar tests. It's when a blood sample is taken at a random time and the blood sugar is taken, and the higher, like if it's 200 milligrams per deciliter or higher, it suggests that the child has type 1 diabetes. Another test is the glycated hemoglobin test. In this, it indicates the child's average blood sugar level for the past 2 to 3 months. More specifically, this test measures the percentage of blood sugar attached to the oxygen carrying protein in red blood cells, which is hemoglobin. This test resulting in 6.5% or higher on 2 separate tests would indicate diabetes. A fasting blood sugar test. This is something that would be taken, a blood sample that would be taken after the child fasts overnight. A fasting blood sugar level of 126 milligrams per deciliter or higher would indicate type 1 diabetes. The prevalence of this illness is fairly common. Approximately 1.25 million American children and adults have type 1 diabetes. 1.5 million Americans are diagnosed with diabetes every year. That includes like all kinds of diabetes. So there's different classifications, but this presentation is specifically about type 1 diabetes. About 193,000 Americans under the age of 20 are estimated to have diagnosed diabetes, and that's approximately 0.24% of the population. So some demographics that are affected by this illness, there's actually a pretty big prevalence over minorities, and it actually gets higher in the populations that aren't white. And so whereas 7.4% of non-Hispanic whites have diabetes, 8% of Asian Americans do, 12.1% of Hispanics do, and 12.7% of non-Hispanic blacks, and 15.1% of American Indians and Alaskan Natives. And this information is based on diagnosed diabetes in adults. And this is just the breakdown based off of race and their ethnic background. So now that we've covered the basics, we can move into treatment of type 1 diabetes. It is a lifelong treatment plan, and it includes blood sugar monitoring, insulin therapy, healthy eating, and regular exercise, even for kids. But as a child grows and changes, so will his or her diabetes treatment plan. A child will have a diabetes treatment team, doctors, diabetes educator, and dietitian, just to name a few of the positions on the team, to support, and that will work closely to keep the child's blood sugar level as close to normal as possible. So kind of just some basic parts of what the treatment plan might entail is blood sugar monitoring. It is necessary to check and record a child's blood sugar at least 4 times a day, but probably more often. This requires frequent finger sticks. Some blood glucose meters allow for testing at sites other than the fingertips. Frequent testing is the only way to make sure that a child's blood sugar level remains within his or her target range. This can change as a child grows and changes, however. A child's doctor will let them know what the child's blood sugar target range is. And then continuous glucose monitoring is different, but it's the newest way to monitor blood sugar levels. It can be most helpful for people who don't experience the usual warning symptoms of hypoglycemia, which is the scientific word for low blood sugar. Continuous glucose monitoring uses a fine needle inserted just under the skin that checks the blood glucose level every few minutes. Continuous glucose monitoring isn't yet considered as accurate as the standard blood sugar monitoring that I just mentioned, but it can be an additional tool, but generally yet won't replace regular blood sugar monitoring. Anyone who has type 1 diabetes needs insulin treatment to survive because, as I stated earlier, their body can't produce the blood sugar or the insulin like it should. There are many types of insulin available. There are 4 that I will touch on in this presentation. The first is rapid-acting insulin. This starts working within 15 minutes and peaks in about 1 hour and lasts for 4 hours. Short-acting insulin should be injected 20 to 30 minutes before a meal. It'll peak in 1 to 2 hours and last for 4 to 6 hours. Intermediate-acting insulin starts working within about an hour. It peaks in 6 hours and lasts 12 to 24 hours. And long-acting insulin has almost no peak, but may provide coverage for as long as 20 to 26 hours. So those are the types of insulin, and then there are different kinds of delivery for the insulin depending on the child's age and needs. So one that is very common is the fine needle and syringe. An advantage of needle and syringe is that some of the different types of insulin can be mixed in a single injection, which would reduce the number of injections. The insulin pen, it looks like an ink pen except for the cartridge is filled with insulin. These pens with mixed insulin preparations, those are available, but they're not generally tailored for children. And then an insulin pump is a device that's about the size of a cell phone that is worn outside of the body. A tube connects a reservoir of insulin to a catheter inserted under the skin of the abdomen, and the pump can be used in conjunction with continuous glucose monitoring, which I just mentioned on the previous slide. Another part of the treatment plan will include healthy eating. A child won't be restricted to a lifetime of a diabetes diet of boring, bland foods. Instead, children with diabetes just need plenty of fruits, vegetables, and whole grains. These foods are high in nutrition and low in fat and calories. Ideally, a children's intake of carbohydrates should be consistent. A child's dietitian will likely suggest that the child and the rest of the family consume fewer animal products and sweets. This eating plan is the best for the whole family. Sugary foods are okay once in a while as long as they're included in the child's meal plan, and so that they're planned for. Understanding what and how much to feed a child can be a challenge. A dietitian can help to create a meal plan that fits the child's health goals, food preferences, and lifestyle. Certain foods, such as those with a high sugar or fat content, may be more difficult to incorporate into the child's meal plan than the healthier choices. For example, high-fat foods may cause a spike in blood sugar several hours after the child has eaten because fat slows digestion. Unfortunately, there is no set formula to know how a child's body will process the different foods. But as time passes, they'll learn more about how a child's favorites affect his or her blood sugar, and then the diabetes support team can learn to compensate for them and by adjusting their meal plan so that the child is still able to eat all of their favorite foods. Physical activity is, again, another part of the treatment plan for type 1 diabetes. Everyone needs regular aerobic exercise, and children who have type 1 diabetes are no exception. Physical activity should be part of the child's daily routine, but remember that physical activity usually lowers blood sugar and can affect blood sugar levels for up to 12 hours after exercise. The child will then need to check their blood sugar more often than usual until they learn how his or her body reacts to the physical activity. This part of it is especially important for new physical activity, such as taking up a new sport, those sorts of things. They might need to adjust the child's meal plan or insulin doses to compensate for the increased activity. So these are some recommended resources. Childrenwithdiabetes.com. They have conferences. They have a lot of information. Things such as like having type 1 diabetes and traveling, type 1 diabetes in school. They have resources for people who are new to a child with diabetes or anything like that. They have a whole slew of recommended books for children and families that are affected by diabetes. These are just a few that I found appropriate for the age group in this presentation. So Diabetes: An Emotional Journey by Renee Jo Zosel. This one would be good for families and children. It seems to be like a pretty age appropriate book for anyone and can be read like as a family or like just like as just a family group. Even just one-on-one with the child. It could also be used in classrooms. Balancing Diabetes: Conversations About Finding Happiness and Living Well by Carrie Sparling. This would be one that seems to be a chapter book, so it would be good for school-age children, especially on the higher end of that age group, and adolescents. This is a book that they can read on their own. I think that's something that a lot of the school-age children who have type 1 diabetes struggle with, is that they feel like there's something wrong with them, but really what just needs to happen is they have to really figure out how to live with type 1 diabetes. Like their life doesn't have to change all that much. It just is about learning how to treat it and live with it and keep it in check. And so I think that this one will be really helpful for that, and just kind of while they're searching for their identity, this could just kind of like slow things down or turn them upside down, and so it would be good for that. Breakthrough: Elizabeth Hughes, The Discovery of Insulin and the Making of a Medical Miracle by Thea Cooper and Arthur Ainsberg. This one would be really good for children who are really interested in history and science. It also seems to be a chapter book, and it also could be one for the classroom or for families read together. It seems to be very interesting and would be really interesting, especially for someone with type 1 diabetes. Cheating Destiny looks to be a chapter book as well. Good for school-age children, but probably very good for parents with school-age children. And it talks a lot about the science in a way that parents would be really able to understand, especially those who aren't really involved in the medical field, have never really had any exposure to type 1 diabetes. So as far as the developmental stage of school-age children, the psychosocial theory that they're in is the industry versus inferiority stage. They tire of the make-believe games. They want to make something or complete a task interesting or worthy. They don't want to do something that's not worth their time or that they don't find to be fun, and they develop a sense of confidence in their abilities, which means they're also learning like what things they're good and not good at. For cognitive development, they're in the concrete operational stage, which means they can think logically and they're no longer egocentric. Developmental tasks for school-age children. In physical development, this is a complete takeover of body management, meaning that they are learning how to go to the bathroom on their own and all of those sorts of things. There's an increased smoothness and speed and fine motor control. There's a rapid growth in height and weights, especially for girls. This part of the physical development is going to be especially important for those with type 1 diabetes because, as I mentioned on one of the first slides, when the child's body is growing and changing, that means that their treatment plan is going to change too. So this is going to take a lot of monitoring, especially for those with type 1 diabetes in this developmental stage. For cognitive and language development, there's an interest in acquiring knowledge. They're more critical of self. This can also be a challenge for those with type 1 diabetes, just because during their treatment plan, especially when they're in school, it can make them really self-aware of what they're doing and how others perceive them. And so this would be very important for just to be aware of, as far as like that we know that in this stage of life they're becoming more critical of self, and so acknowledging that in their treatment plan for type 1 diabetes is really important. There's an understanding of relationships between things and ideas, makes simple opposite analogies, knows seasons and rhymes. For social and emotional development, they develop modesty, they invest in familial relationships, and there's team play. Especially in the investment of non-familial relationships, it's important that their friends also know about type 1 diabetes, and so they're not as confused and they don't kind of alienate the child because of it. That's why friendships are especially important during this time, because they are desiring, as they move into the school age, to invest in their non-familial relationships. And so, but this type 1 diabetes can kind of sometimes be an obstacle about it, which I will talk about shortly. So there are a couple really main negative effects for the child's development. Type 1 diabetes can have a negative effect on students while they're at school, socially, distraction during class, etc. It would also be important to walk through the treatment plan with the child and make sure they know how to do it, how to take care of their own treatment plan, so that they can do it themselves. It would also be important to share the treatment plan with teachers and the school nurse. Most school-age children will get caught up during the day and forget to do the treatments, so it's necessary to adopt some sort of system, an alarm, a reminder, the school nurse coming to the classroom to get the student, to ensure that the treatment isn't forgotten. The student's treatment plan doesn't pause while they're at school, and their blood sugar is still changing while they're at school, and so it's really important to take that into account and to put the correct steps in place so that their type 1 diabetes is really being taken care of while they're at school. Type 1 diabetes can also have negative effects on their social life and their social development. Students in their class may not understand type 1 diabetes or the treatment that's necessary that accompanies type 1 diabetes. So students can be confused, they can make fun of or exclude the student with type 1 diabetes. So this is kind of why, especially in relation to the development that happens in their desire to invest in their non-familial relationships during this period of school age development, because of this negative effect on the child's development and the part of development of investing in non-familiar relationships, it can be really important to just put kind of some of the correct steps into place so that the student isn't really taken back or really facing a big obstacle during their development and in their type 1 diabetes. So some issues that could be related to hospitalization. Generally for type 1 diabetes, there isn't a lot of hospitalization involved unless something goes awry, but this is something that really could happen, and so in that case, these are some issues that would be related to that for school-age children in this specific developmental stage. So for physical development, regression may be seen, for example, bedwetting, whereas they were supposed to be able to monitor and control their own bodies. And there's also the altered body image, either actual or perceived. Under cognitive and language development, there are fears of not being well again, body-altering, painful procedures and surgeries. Many questions arise regarding the hospitalization and illness, and there's anxiety about death that becomes very prominent during this time. Any obstacles in communication can be really frustrating for the student, and obviously the periods away from school can be bad for their grades and their cognitive development and what they're learning in class. For social and emotional development, the separation from peers and family can be bad. There is a fear of not fitting in or being different. They might act out or withdraw. There's a decrease in self-esteem. Issues of succession failure arise, and there's a lack of consistency and structure. A lot of these I talked about in previous slides, but they're all really important to be aware of, especially for school-age children. So these are some interventions in the case of hospitalization that would be helpful as far as what the child life specialist can do in order to help with these things. So for physical development, you can provide activities that address and encourage discussion around specific body imaging issues, such as making hats, finger casting, quilting urine bag covers, etc. There's role play with the student or with the patient student about how he may handle comments made by others in his appearance. Encourage other activities that make patients feel better about their appearance, such as manicures, makeovers, washing, styling hair, making jewelry, and tie-dyeing t-shirts. This specific intervention, this description seems geared toward girls, so for boys, it is just kind of seeing what this patient really values about their body image and how to make that how to make them feel better about that. So for the social and emotional development, you can serve as an advocate, you can focus on their special interests, you can encourage phone and video calls from friends, there's field trips to other part of the hospital, communicate with teachers, encourage time away from parents, ways of staying in control like breathing exercises. The part about ways of staying in control like the breathing exercises, that can be really important, especially when they feel like they can't control their bodies due to their type 1 diabetes, and so that one can be used especially when they're not in the hospital. For interventions for cognitive and language development, you can explain procedures using developmentally appropriate medical terminology, explain reasons for procedures using simple diagrams of anatomy and physiology, give tours of specific hospital areas and equipment, explain equipment and its function, and allow patients to manipulate and practice, provide prep books, questions and discussion, provide tutoring, include patient in making decisions by offering choices. Again, there's not a lot of hospitalization that's common for type 1 diabetes, and so a lot of these can be used just in teaching the patient and family how to deal with type 1 diabetes, but there isn't going to be a lot of